Hi everyone, Dr. Rich Castellano, the Smile Doctor. We're back with Ashley, so we're going to be doing the lower eyelid pinch. We did some of the sculpture, so I like to start by marking a little on the skin. How are you feeling, Ashley? Do you feel that relaxing medicine?
Yep, feeling great.
I feel pretty relaxed too, but I did not take any relaxing medicine, so.
Alright, well, that's good news.
Surgery is one of the most relaxing things that I do, right? It's very predictable. I've done a lot of it, and you get a very controlled environment. So with the numbing medicine, I like to use the lidocaine. Now she'll have a little bit of numbness for what we've done, but you'll feel a little pinch here on 3. 1, 2, 3, pinch. So the key here for the physicians and students that are watching, you feel a little pinch there, not too bad?
Yeah, just a little bit. Not too bad.
The key here is we want to preserve the muscle, preserve the fat. You don't want to prematurely hollow the eyes. So we're taking that excess skin. Now I've already measured where you can pinch the skin and see that the lower eyelid position is still where you want it to be. And you just numb across this area, and so you'll see me pinch the skin, and then I will do a little trim, and then it just requires 1 stitch. That is the conservative way, because we get that little excess, the crepiness of skin, the crinkles, and that all contributes to a little tiredness and aged appearance under the eye. So this is lidocaine under the eye, and even though Ashley knows we're here, can't really tell what we're doing. She knows I'm numbing, and then after she doesn't feel anything there, she's going to be in a good place. And so you feel a little pinch, 1, 2, 3, pinch, a little bit of numbing. When you go slowly, it's more difficult to feel it. You feel small, medium, big pinch there?
Just a medium to small.
So we'll go
It's gone.
slowly. We're not in a hurry. I'll tell patients to tell me if they need a break. Most patients say, that's fine, just keep going. And so if you go slowly, the patients are completely fine. A lot of doctors they just don't know how to do procedures under local anesthesia. They're not practiced at it. They can easily get impatient, so it's something you have to know how to do. You have to do it a lot to be good at it.
Someone's asking, what are we doing?
We're doing a lower eyelid skin pinch. We already did some sculpture to build the volume and to build collagen. So now we're taking some of the excess eyelid skin and we're doing our best to prevent traditional lower eyelid procedures, because this is the safest way to do things, taking the skin, preserving the volume, building the volume with the collagen stimulator Sculptra. I'm wearing my 3M VersaFlow PAPR, protect our patients and protect myself. Of course, I've had the vaccine. I do recommend all of our patients get the vaccine. Do you feel a little pinching here or not really?
Nope, nothing.
Thank goodness for lidocaine. So once I've done the numbing, for my physicians and students, I use brown absence and a tooth forceps, and then I'm just grabbing this little area where I marked, and I'm focusing right under the eyelash line. Everything's looking good. Are you feeling any pain there?
Nope.
So you can see we can comfortably remove this amount of skin, and it'll look natural. It hides and heals very nicely. So I'm firm with the amount that we pinch, and then I'll, as they say, measure twice, cut once. I'll go across the entire length of the eyelid. Right, if I need to come back later and take more, it's always better than going too far. We're not going to go too far. I think the likelihood we need to take more later, I think that's pretty low. This is artistry. In addition to what we remove, the body goes through its healing process, so there's always these variables, but we take all of that into consideration with the treatments that we offer. So that's a safe amount of skin that we can take. We're probably looking at, let's just say, 7, 8 millimeters. And we're going to go all the way across. And it's not so much about the amount, but it's about where you're taking it from. And of course, how you take it. So now that we've got a comfortable margin there, then I take my iris, and we're just elevating the skin in just a little fit in through here, and so we're right under the lash line there. Everything's looking good. Perfect. So I'd say about, let's call it 6-7 millimeters, right, of width at the most, at the widest point of that fusiform incision. We have our bipolar cautery, and sometimes you can even do this without cautery because the suture alone will keep it closed and keep it hemostatic. Stop a little bit of bleeding. You feel a little bit of pinch there or not really?
Nope, nothing.
Lidocaine is our friend. We preserve and protect the eyelashes, but of course we don't recommend that you wear false eyelashes to the procedure because they can get in the way. And Ashley has nice, taking good care of her eyelashes. Just little dots here and there to just treat that. You'll feel my finger there. Good. Everything's looking good.
Oh, Ashley, your mom just commented. She said you're doing great.
Oh, Mom's watching.
Love
too.
you,
Hi,
Mom.
So Mom's going to be nearby to drive Ashley home. And this is the best way to update Mom, to let her know how Ashley's doing. And she's being such a good patient. We haven't had to give Ashley any warnings or anything like that. I'm just kidding. We don't give warnings. So now that we've done a little bit of the cautery, then I use my 5-0-proline. And this suture is almost the thickness of a human hair. I mean, it is super, super thin. I'm going to turn your head just a little bit this way. So I start medially. This is a running intradermal suture. Very good. And this will bring the skin edges together. Perfect. So I'm just going in and out of the dermis on each side of the incision. How are you feeling, Ashley? You doing okay?
Yep. No, nothing. Just how we like it.
Everything's looking good. Perfect. So it's a meticulous closure, but as you can see, everything comes together very, very nicely. And it falls within the eyelid crease, so it's very difficult to see when it heals. Very good. Perfect. You feel a little pinch there or not really?
No, not really.
I can always add a little more numbing medicine if I need to, but what we've done is obviously enough, and I always ask. I say, how are you feeling? Do you need more? This way, patient is in control. So running subcuticular or running intradermal suture is what this is called. And you see it brings things together perfectly. I'll do a little blot. grabbing the dermis right beneath the epidermis. That way the suture line is hidden. And where you see some incisions where you see little train tracks, that doesn't happen with this because the suture's on the outside. Suture's on the inside rather. So there's no way it can create that little train track appearance. One step at a time. We're in Tampa and in the Villages. I am a double board certified facial plastic and reconstructive surgeon. You can download our book. We guarantee we can make you look younger, and or the Smile Prescription. They both hit the Wall Street Journal bestseller list. There's no physical restrictions for Ashley, though we do need to listen to our body. And you know, even though she's coaching volleyball, right, she can still do her activity, but we definitely don't want a volleyball to hit around the eyes or face. And that does happen, but you just need to be cautious. So this is a perfect closure, right? Everything comes together very nicely. You see how easily the suture draws through, and that will fall right underneath her eyelash line. Ashley, can you open your eyes for me there? See, so that's right in the crease. How many fingers here? 2. Okay, go ahead and close your eyes. So that's picture perfect. That's what we want to see. And then when we're trimming, we always want to keep the point of the scissors away from sensitive areas. And I like to leave about 2 to 1.5 millimeters. Little tail there. And we usually take these out at about 1 week. So that is side 1. We're doing both sides today, so I'm going to come over to the other side. I'm going to add just a little bit more of the numbing medicine here. Do you feel a little bit of a pinch or not really?
Nothing yet.
So I'm doing a little bit extra lidocaine, because why not? You know, we're here, it's not hurting anything. And that billowing appearance of the eyelid skin, that's what we're going to use to create the pinch shape that allows us to remove the correct amount of skin. So, brown acids and fine-tooth forceps. And Rita has everything set up perfectly for us. Thank you, Rita.
You're welcome, Dr. Rich.
I got a great team here. They take great care of me. They take great care of our patients. So we're doing the same thing. I'm out to the lateral aspect of what I've marked for the incision line, pinching the extra skin, seeing that she has very comfortable closure. You can do these types of treatments with canthopexy, but it's really not necessary, and you don't want to tighten the tendon at all if you don't need to, because you don't want to create that Asian eyelid appearance when we don't start with an Asian eyelid. Do you feel any pinching there or not really?
Nope, nothing.
Everything's looking good. So measure twice, cut once. I can see we've got about that 6 to 7 millimeter margin here. So we're doing it. You may choose to remove a little bit more on one side than the other. It's very normal that you have one side that starts differently than the other. Nobody is perfectly symmetrical, so you do your best to balance the asymmetry. And the reality is, even if there's any remaining asymmetry afterwards, it falls under the social radar. So Ashley's going to look presentable. Her symmetry is going to be really great. And so now we just trim that little area. Perfect. So I can see, for the physicians and students that are watching, I can see on both sides of my instrument that the amount that we're removing, and it's very controlled. We're not in a hurry, we just take our time. Perfect, so this is underneath the eyelashes. Very good. So again, we're at that 6-7 millimeter mark of the amount of skin that we're removing. So a little bit of the bipolar. The goal after the procedure is to stay shiny. That if your eyes look dry, then you just reapply. Moist wounds heal the best. And of course, when you put the lubricant, then it makes the vision just a little bit blurry, and that's okay. So as you can see, there's really no significant bleeding there, just little tiny areas that we're cauterizing. So back to the 5-0 proline. Very good. How are you feeling, Ashley?
Great.
Everything is looking good.
Don't feel a thing, so it's amazing.
It's the right way to do it. It is pretty amazing what
Thank
we can
you.
do. This is the safest way to do the treatment. I heard in the radio, they said Ashley's driver is downstairs.
Mhm.
She's watching the video, so. See how nicely that comes together. You can see it just comes together very cleanly. One little stitch at a time. For the physicians and students that are watching, each stitch goes a little bit behind the other, so that way it's staggered and it just draws things together very nicely. And so wherever my stitch exits, then the stitch I place next is going to go a little bit behind that, and that staggered approach gets that nice clean closure. I'm just going to block a little bit here. Perfect. If you're just now joining, I am Dr. Rich Campbell. I'm a double board certified facial, plastic, and reconstructive surgeon. Can you show them on the pictures there? Her before pictures, you can see here's the after and the before. You see her photo there. Now, of course, the current before is Ashley isn't ready for her close-up yet. This is not her final product. Fourth one. Second one. Okay, that's fine. Thank you. Everything's looking good. And then you can back over the last few little stitches here. Perfect. And this incision fades very nicely under the eyelid crease. It's very difficult to see. We will see Ashley at her 1 week follow-up, and at that time, if her stitches are ready to take out, we usually do take them out. Sometimes we'll leave them a little bit longer, but you can see how nicely the suture pulls all the way through. Can you open your eyes for me? How many fingers here?
2.
Very good, and close your eyes for me, please. So, let's get a little bit of this stuff away. But the incision line fits perfectly under her lower lash line. tie that little knot here. No tension. And now I'm just going to look things over. And this little spot here, that comes together very nicely, so I'm just going to let that heal with the Vaseline. You want to shape, just debating on that. That comes together perfectly. Very good. Okay, now, open your eyes for me again. How many fingers here?
2.
How about over here?
3.
So you are completely done. Congratulations. Right, we get right to it. So you can see with the sculptra, trimming the eyelid skin, you keep things that simple. Here's her, if you're just now joining, here's the under the eyes that we want to soften with filling the volume in and taking some of that excess skin. So lower eyelid skin pinch. I'm Dr. Rich Castellano. We're on a mission to stop bad plastic surgery. We're here to help you raise your standards and do things the right way. We'll see you in the next video. Thank you for watching, and please share. If you have a family member or friend that's interested in doing something, they need help, we will give you guidance. Look forward to seeing you in the next video. Great job. You did really, really well. I'm super happy with what I see. And Rita had everything set up perfectly. So now we're just